Okay. Well, we're ready to talk about the reproductive system. We're going to completely separate it into two parts. Today we're going to cover male reproductive system. Next class period, female reproductive system. It's about half and half with the notes. But the reason we do male reproductive system first is because it is much simpler than the female reproductive system. Okay? Male reproductive system has a lot of anatomy you have to learn. And some of you snicker and say, I think I know the anatomy. Well, I know you know what the outside structures are called, but most people, even men, don't necessarily know the names of all the internal structures. So the anatomy is going to be the more difficult part of male reproductive. Next class period, when we do female reproductive system, the anatomy is not quite as complex. What makes female reproductive system complicated are the interplay of the hormones. Okay, now, I don't mean that to say men don't have hormonal surges just like women do. Men have ups and downs with their hormones, but men have just one major hormone that we have to worry about what it's doing, and that's testosterone. With women, there are mainly estrogen and progesterone, but there are others that are constantly going up and down throughout a woman's cycle that changes her mood, changes things about her body, and that's what makes the female reproductive system fairly complicated. Okay. We're going to talk about primary organs and accessory organs. Okay, we've been doing this through the whole semester. What makes something a primary organ? One that does the most work, the one that does the essential job. Okay, it's the one that you absolutely have to have. All the accessory organs just help, but you could actually take all those away and you could still accomplish the job of the system. What's the overall goal of the reproductive system? To reproduce, make more people. Okay? So the only thing you absolutely have to have in order to make a new life is an egg and a sperm. And the organ that makes the sperm is the testes, the testicle, and the organ that makes the egg is the ovary. So truly, as long as you had those two, you could accomplish the job of the reproductive system. So those are the only two primary organs. Okay? They make our sex cells, which are called the gametes. That's the sperm and the egg. Now, also within these primary organs, that's where we're going to see our hormones produced. We're going to talk specifically about hormones separately after we talk about structure and pathways. Okay? Our accessory organs are going to be mainly ducts. Ducts are just channels that allow things to move from one place to another. Okay? So with the male, the ducts are going to be getting the sperm out of the body. With the female, the ducts are going to be involved with getting the egg to the appropriate place where, if it is fertilized, it can implant, produce a baby, and produce an environment for the baby to grow. Okay? We're going to talk about glands. Glands are going to secrete different things. Okay? Going to see this some in females, but this is mainly with the male reproductive system. They have several glands that secrete different types of fluid to produce semen. Okay? Semen is not made in one place. Semen is a collection of several different things put together. Okay? And then last, external genitalia. We're not really going to talk about that much because we're all adults in this room. I think we all know what the external genitalia is for men and women. And its only job is for stimulation. And in the sense of the male, it is also for delivering sperm. But it doesn't really have a whole lot to do with what we're talking about, and that's producing a baby. Okay? Y'all are still being very serious. All right. So the sex hormones. They do so many different things. We're going to try to narrow it down and look at just what the sex hormones have to do with production of the sperm and the egg. Okay, that's where we're going to be focused after we get away from this little introductory part. But keep in mind, as we do all of this, everything we talk about, the development of all of these reproductive organs involves the same hormones we're going to talk about. Not only their development once they're completely developed, how they function on an everyday basis depends on hormones. Okay? Now, every day, a woman and a man is not trying to produce an egg and a sperm to make a baby. Okay? That's not their overall goal every day. Their overall goal every day is to survive. But every day, throughout the day, these hormones are being produced at a certain rate, sending signals to the ovaries and the testicles, keeping all of this on target. Our sexual behavior, sexual drives are driven by the same hormones. And as we get towards the end and we look at the female cycles, it's kind of a little irony I get to show you. Sexual drive is completely related to the amount of hormone produced. Men's sexual drive is related to the level of testosterone they produce. The more testosterone, the higher their sex drive. Men peak at their ability to produce testosterone in their early 20s. That's when men have their highest sex drive. And it's kind of the funny irony. Women's peak of sex drive, their ability to produce estrogen, is way down here when they're in their early 20s. And as the men starts to go down as they reach 30, that's when women kicks up. So it's kind of this funny irony that when the men are really into it, the girls really aren't. And then as the women really get interested, the men are like, well, I give up. I'm tired of being interested in it, and the woman's not. So just kind of funny. All right, and then we're not going to talk about growth and development of other organs, but you all know that involves the same sex hormones. The development of a woman's breast, even though they're not really involved with making a baby, that is still estrogen linked. The production of excess hair on a man, men's chest also grows. That's also linked to testosterone, even though it doesn't really have anything to do with what we're talking about in here. Okay? All right, so let's get to the male reproductive system. In the male reproductive system, we need to talk about the anatomical structures of the testes as well as the scrotum, which is just the house that the testicle lives in. They are responsible for producing sperm. Once the sperm is produced in the testicle, it has to travel through several different ducts to get out of the body. First, it goes through the epididymis, and we're going to talk about each of these structures. Then through the ductus deferens. A lot of you don't recognize the word ductus deferens, and that's because you've heard it called vas deferens. They're the exact same thing. Just proper anatomical terminology is ductus deferens. From the ductus deferens, it goes into the ejaculatory duct, and then finally into the urethra for expulsion out of the body. The urethra we've already talked about, right? Why have we talked about the urethra already? It's how urine leaves the body, part of the urinary system. Okay? So at some point we are going to talk about how the urethra knows which one it should be expelling at certain times. Okay? All of the sex glands, the accessory glands we need to talk about, seminal vesicles, they are going to secrete a large volume of fluid. The prostate, okay? All of you probably know men have a prostate, but very few of you probably really know what the prostate is for. Okay, and that's just a fact. Most people don't really know what it's for. And then the last one's the bulbourethral glands. We're going to talk about what they secrete. All right. Now, here is your pelvic cavity side view of the man. It's going to be on your final exam. So you need to know where all of these structures are located. Okay. A lot of them we've already talked about. The darker colored ones are the ones that are reproductive system. Okay. Back here, this is a portion of the rectum. Okay. This is your coccyx, right? Part of the butt bone. This is the pubic bone in the front. So some of that you've already seen to kind of orient yourself. This big dark ball right here, that's the bladder. Okay. Now all the new structures, we'll start with where sperm is made and how it comes out of the body. Down here, this is the testicle. Now, I didn't say this yesterday, and it kind of seemed to confuse some people, so let me make sure you know. You all know that there's two of everything, right? There's two testicles. So if there's a tube that drains the testicle, there's got to be two of them, right? Okay. Just showing one in the pictures. All right, so here's one of the testicles sitting inside of the scrotum, just the sac around, okay? Wrapped around the testicle is this big, thick duct that's called the epididymis. The epididymis has a head, a body, and a tail. At the tail region, the epididymis gets really thin, and then it becomes the ductus deferens, or vas deferens. And this whole thing is the vas deferens. So that's the big long tube that takes the sperm all the way from the testicle up into the body to get it into the correct orientation so all the little glands can secrete the different fluid with it. Okay. It's written on a slide later, but while I got this picture, I'm going to go ahead and show you. When a man has a vasectomy, which is a permanent type of birth control. They cut the scrotum, really, really tiny cut right here. Takes one stitch to fix it back when they're done. They reach in with a little pair of tweezers, grab this tube right here, and they literally just cut it. And then actually nowadays they tie the two ends in a knot, because they used to have a problem with, over time, the two pieces would find each other and self-heal and go back together, and then men were able to get women pregnant again. So now they tie that baby in a knot on each end, singe it, make sure there's no chance it's going to go back together. Okay? Very simple surgery. And the reason I point that out is I'm going to show you what women have to do to get their, quote, tubes tied. You'll see it's a very, very invasive procedure. This is outpatient. They don't even have to put the man to sleep. My husband insisted on being put to sleep. So he was put to sleep during his little procedure. But most men, they don't even put you to sleep because it's very, very simple. But I guess most men don't like the idea of somebody chopping on something that's that important to them, so they like to be put to sleep just to make sure. All right, from the ductus deferens, you have right here at the end this big gland. That's called the seminal vesicle. Once the seminal vesicle joins this little bitty short region right here, is called the ejaculatory duct, which is a really, really tiny portion. Okay. Once the ejaculatory duct enters the area where the prostate right here is wrapped around, it becomes the first part of the urethra. Then the urethra continues all the way down through the penis until it leaves the body. Wrapped around the urethra is the part of the penis that's called the corpus spongiosum, the spongy part. It is there just to protect the urethra. It doesn't fill with blood. Out here in the front are two paired regions called the corpus cavernosum, and they have little caverns, little regions that can fill with blood to produce an erection. Okay. No, that's why the tip never gets, it's called the glans penis, the tip. That's why it never gets as hard as the other portions, because the blood does not pool in that area. And that's because if the blood pooled in that area, some of y'all are giggling now, if the blood pooled in that area, it would smush the urethra, and then when the man did ejaculate, nothing would be able to come out because the urethra would be clamped down. Okay? Good question. See, I like questions. All right? Last one I didn't go over. That's this little tiny gland at the very base of the penis called the bulbourethral gland. Its job is to secrete a fluid that cleans out the urethra so that there's nothing left in it when the semen that has the sperm is going to come through. So its job is to make sure there's no remnants of urine left inside the urethra. Mm-hmm. Well, yeah, and that's something, let me go to a different picture to answer your question, and then I'll come back. Well, shoot, I thought I had a picture. Did I pass it? Okay, yeah. So this is kind of what uncircumcised looks like. What they do to circumcise a baby, they grab the foreskin and they pull it off, pull it over the top of the penis, and it's so barbaric. And they literally just take and they chop and cut it. And then when they let it go, it'll fall back down so that you don't have that little piece of skin wrapped around the glans penis, the tip of the penis. The reason men are more likely to get an STD if they are not circumcised is because it's harder to keep it properly clean. After sex, a man is supposed to make sure all of the ejaculate is removed from the urethra and everything is clean. But if all of this skin has folded down on top of it, if you don't make sure you pull it back and clean it all, you are much more likely to get an infection. So that is true. And that's the reason. Now, some people decide on circumcision yes or no based off of religion. But in the United States, the reason we medically recommend circumcision is a cleanliness factor, because it's a lot easier to keep it clean and keep infections from occurring. But you just feel so bad for him. If you've ever changed a little baby boy's diaper a day or two after he's been circumcised, he just screams when you touch it and it's blood red. I mean, you just feel so bad for him. They do. The day you take them home, they grab them, take them in there, chop it, and then say, "Here you go, take him home." put some cream on it every time you change his diaper for little babies. All right. So are we good with the anatomy? Okay. All right. Let's talk about what each piece of the anatomy does. All right. The scrotum. The scrotum is a sac composed of several different layers. Its job is it is to protect the testicles. Now, most people would probably have the question, if the testicle is so important, right, it produces the sperm, the man's ability to reproduce, why is it hanging outside of the body, right? We take all our other important organs and we stick them way inside of our body and we protect them with bones and lots of fat, right? Well, we put the poor little testicles way out there and we just leave them exposed. And most men say it hurts pretty bad if you get hit there, okay? So there's got to be a reason we leave them outside the body, right? And the reason is sperm cannot be produced in a way that it is able to fertilize an egg unless the sperm is kept 3 degrees Celsius. That's a lot. That's like almost 12 degrees Fahrenheit less than the rest of your body temperature. Okay, so body temperature is 37 degrees. That's what your heart and your brain like. Testicles have to be kept at 34 degrees Celsius, or the sperm is no good anymore. Exactly. They recommend men wear boxers, especially if they're having a hard time impregnating a woman, because the warmer the sperm is, the less likely a woman can get pregnant. So if a man's in a hot tub or a sauna, the sperm that's actually inside of the testicles at that moment will not be viable. Now, I'm not saying that you can just have fun in the hot tub and not get pregnant, because men are constantly making sperm. But those that get that warm are not able to impregnate a woman. In order to make sure temperature is kept just right, men have special muscles that ladies don't have called the cremaster muscles. The cremaster muscles elevate the testicles and lower the testicles. Okay? The dartus muscles make the scrotum more wrinkled and not wrinkled, but it's also involved in the same thing. Dartus muscle is also involved with urination. The cremaster muscle is the main one that just raises and lowers the testicles. So if a man is cold and his body temperature drops a little bit and the testicles get cold, the cremaster muscle will contract and they'll move a little closer to the body so the sperm can be kept warm. If a man gets hot, it's relaxing all the way, and then a drop. So they can get as far away from the warm body as they can to try to keep the sperm cool. Okay? Okay, be real. Ask this nasty question. It cannot be the worst I've heard. Okay, that is simply, as everybody ages, your skin thins. And so the only reason an older man looks like he has lower hanging testicles is not a temperature issue. It's because his skin is thinner and he can't raise them and lower them. And some men just have lower hanging testicles than others too. And you guys are going to see that. Those of you that want to be nurses, y'all kind of are giggling and snickering right now. You just better learn how to look at a penis and say penis and flop it where you need to put it, because you're going to have to do that. Okay, well, I'm recording myself. I shouldn't say this, but I'll tell you guys a funny story. When I was in high school, I worked in the emergency room, and I was like the little paper pusher. This man came in, and he had been in a bad car accident, so of course he was butt naked, right? Well, if you're naked and they're working on you, they don't make sure they keep you covered. They brought him in there, and they flipped the covers off, and I mean, I was in high school, and my eyes just got real big. And this poor guy would roll him over and check his back, roll him back over, and he was rather well endowed. And they would grab his penis and then just kind of throw it back where they needed to go, and then they'd throw him the other way. And I can still laugh thinking about that, seeing that when I was 14, 15 years old. But so those of you that are going to be nurses, just get used to it. It's just another body part. What's your question, Vera? Have what? All old people are much more likely to have intestinal worms. No, not in their penis, no. There is a protozoan that can crawl into the male urethra if they swim in certain water supplies. But and there's even a little fish that does it too, because it just thinks it's cool looking, I guess. But no, that's not true. That's not true. All right. Good, y'all are getting a little more interested, okay? So to show you the layers of the scrotum, first you have the skin on the outside, and I love that the author thought we needed the illustration of the hair. I'm glad that was really necessary. So you have just typical skin on the outside. Underneath the skin, you have several layers. You have some fascia and some fat layers. Underneath that, you have something called the tunica vaginalis. If you remember in lab when we were doing our testicle dissection, there was that really thick, tough layer we had to cut through. That's the tunica vaginalis. That's the protection. Under that's the tunica albuginea, and that's what was wrapped directly around the testicle. And the reason you have to have all that tough stuff is because the testicle itself is very soft. Hey, otherwise, if kicked, the testicle would crush if it didn't have all the tough layers around the outside. Okay, here's where how the cremaster muscle kind of wraps all the way around the testicle so it can raise and lower. Have tons of blood supply going in. That's called the pampiniform plexus, just giant collection of blood vessels and nerves. You know, I don't know. I've heard that before. And my scientific mind says no, because you'd much more likely be able to kill a man by doing something to his penis, because there's much more blood flow to the penis than the testicles. Yeah, I agree more with Andy. He would probably just wish he was dead more than he probably would really die. But I've always just thought to myself, can it really hurt as bad as men act like it hurts? You know, and all the men in the room were like, That's useful information. Remember, I am married, Andy. That's useful. Oh my gosh, okay, I'm not going to comment on that one. All right. It hurts women too. I guess we just don't feel the pain as often because it's harder to hit us in that area because it's not as hanging and exposed. So we have to literally fall on something like on the playground or something like that. But yeah, you're right. Women do have you just have a lot of nerve. You have a lot of pain receptors down there because it's important. You don't want something to hurt that. That's for reproduction. All right, so let's look at the inside of the testicle. And I know we've done this in lab, but the inside of the testicle has... We didn't do a dissection in lab? Yes, we did. Yeah, we did. Y'all were there, too. Yeah, we talked about how you could eat a testicle. Yeah, we did this in lab. You were there? Maybe this will jog your memory, okay? So when we cut the testicle open, it just kind of looked real mushy. The inside of that mushy stuff was all these little seminiferous tubules. Inside of the seminiferous tubules is where the sperm is made. You have little septums, which are called septa, plural, in between. You couldn't see those in the testicle, but that's where all the little accessory cells called the Sertoli and Leydig cells, all those are there, and that's where they make testosterone. Okay? So the sperm's made in the seminiferous tubules, travels to the rete testes, little collection area, and that looks like a little white strip in the middle of the real testicle. Okay? From there we go out efferent ductules, drain into the head of the epididymis, then the body, then the tail. Okay? In the tail region of the epididymis, that is where the sperm gains the ability to swim. Okay? If you get sperm from a seminiferous tubule or the beginnings of the epididymis, it is not a mature sperm, and it is not ready to be inserted into an egg to impregnate a woman. Okay? Down here we kind of see the flip and the crossover. This now becomes the ductus deferens, the vas deferens, goes up inside the body to carry the sperm. Okay? Have I said anything about semen yet? I've just been saying the word sperm, right? Someone asked me yesterday, so if someone has a vasectomy, they still have an ejaculate. Absolutely. The only thing missing from the ejaculate is the sperm. It looks exactly the same because sperm is microscopic. You can't tell the difference. You have to look at it under the microscope and see that it just does not have sperm in it. Everything else is exactly the same. Okay? All right. The penis, major organ of the external genitalia of men. Okay? If we look at the penis from this view, Okay, so here's the urethra down the center. The tip of the penis, as you guys were calling it, is actually called the glans penis. It's just the tip or the head of the penis. Then there's the shaft or body of the penis. In the shaft of the penis is where you have that corpus cavernosum. That's the part that can fill with blood. Okay? This picture at the bottom shows you kind of the cross section. Okay? Urethra is at the bottom with the spongiosum around it. That's what keeps it from being crushed during erection. And then you see you have two paired regions of the corpus cavernosum that actually fill with blood as the man is having an erection. Okay? Let me go back to this other picture. I forgot to say something. Okay? Now, then the men will like that I point this out. What we can see outside of the body is not the entire penis. Okay? So if you look at this picture, right, what would you be able to see? Just from about right here down, right? The man's penis actually extends much further into the body. So it's bigger than what we can actually see. Okay? And someone asked me, and the answer is yes, there really are surgeries men have. I don't know why they won't do this, but they will cut this ligament at the top so that more of the penis will be visible from the outside of the body. That's the way of making it bigger. That's how they do it. They just cut the ligament, and that's how they make it bigger. Not really making it bigger. They're just letting more of it show outside of the body. But then when the man has an erection, it's not going to look normal because you would have this ligament holding everything up. It's still going to be pointing down. I need to put my hands in my pockets. All right. Okay. All right, so let's talk about the ducts. How does the sperm get out? First, the sperm has to go through the epididymis from the testicle. And as I said, the sperm is not motile inside of the epididymis. It moves very slowly through there. Sperm that is made in the testicle is not the sperm that is immediately sent out in the ejaculate. The sperm stays inside of the epididymis for a short period of time, depending on how many times the man ejaculates. So I can't say exactly how long it's going to stay in there. Okay? The epididymis contracts. It is a muscular duct, and it contracts when it's time for the man to ejaculate. Then the sperm leaves, goes into the ductus deferens. Nothing happens to the sperm in the ductus deferens. It's just traveling along until it gets to the ejaculatory duct. At the ejaculatory duct, that is where the little seminal vesicle dumps in, and that's when we're finally going to call it semen. So it's not called semen until it gets to the ejaculatory duct. Okay? All right. The urethra, I know we've already gone over this. You have 3 parts of the urethra. I would never make you label. I'd never point to those parts. The different parts of the urethra are simply named for where they are. Prostatic urethra is around, the prostate's wrapped around it. Membranous urethra is in the penis that's inside the body. Spongy urethra is in the penis that's outside the body. But not that big of a deal. All right? So what are these glands we keep talking about doing? The seminal vesicle. It's the largest gland, and it produces the largest volume of the semen. What is in it is, it's very alkaline. What does that mean? Basic, high pH. The reason it is high pH is because guess what the woman's vagina is? Low pH. Okay? So the men put the sperm inside of something that's high pH, so when it gets inside of the woman, the low pH of the woman won't kill the sperm. Okay? You have to kind of keep in mind, this poor sperm is fixing to be sent into the harshest environment possible. So all of these secretions that the man puts around the sperm is simply to protect it when it's trying to make the path through the woman. Because the woman's body is not very friendly. Okay? Yes, that makes sense. Right? Other than it being alkaline, there's tons of fructose and ascorbic acid. What's fructose? Sugar. Why would sperm need sugar? What does our body do with sugar? Make energy. Does sperm need energy? Yeah, they got their little flagella, and they've got to swim. They've got to make tons of ATP. So we're just putting a whole bunch of sugar around it, providing food and nutrition for the sperm. Okay? We're going to talk about the prostaglandins more when we get to women. The prostaglandins that are in the seminal fluid, in the semen, it actually tells the vagina and the uterus not to push the sperm back out. Okay? Normally, how does peristalsis work? Think back to intestines. moving stuff out, right? Well, the female reproductive system does peristalsis. That's how we get babies out. Well, when the sperm hits the vagina, those prostaglandins tell the female body, stop doing normal peristalsis, do it in reverse to help the sperm get further into the female body where it needs to go. Now that's pretty neat, right? There's never a time when you can tell your intestines, wait, push the poop backwards. Okay, it just doesn't work like that. Okay, so that's the seminal vesicle. The next one is the prostate, which is, no spell, right? Prostate, okay? The prostate is involved with adding a little bit more fluid into the semen. It adds citrate. Well, citrate's just another sugar, okay? More nutrition for the sperm. A few enzymes and something called prostate-specific antigen. You don't have to know all these details, but that helps to mature the sperm, okay? So if a man does not have a prostate, can he still get an erection? Did I say this had anything to do with an erection? No. A man can still get an erection if he does not have a prostate. And that's one of the most common misconceptions. People think, oh, he had prostate cancer, he can't have an erection anymore. Yes, he can. If he's had prostate cancer or something wrong with his prostate, he may not be able to get a woman pregnant because he's missing an activating factor for the sperm. If the prostate swells, it makes it harder for a man to urinate or ejaculate because that swelling will crush on the urethra. But that's the only thing the prostate is for, mainly for activating the sperm. Okay, just getting it a little bit more ready, giving it a little bit more nutrition. All right. The last one, the bulbourethral gland. Remember, those are those tiny little glands at the top of the penis. They secrete an alkaline solution that comes out of the man before the semen gets there. Pretty close together, but its job is to help to lubricate because this is supposed to be being placed into a female, so you got to get ready for that. And it's also going to neutralize any urine that's inside of the urethra. So before somebody asks me, this is what you call pre-cum. Okay, that's what is coming out of the bulbourethral gland. So what is in pre-cum is no sperm. Okay, and oh, well, I read my 17 magazine. You can get pregnant from pre-cum. Okay, that's if you have a marathon sperm that from the last ejaculation, he was holding on and just waiting and hoping that it was going to happen again, and then he was flushed out with the bulbourethral gland secretion. That's really, really unlikely. The main thing that's going to be in this solution, in this secretion, is the alkaline secretion and small amounts of urine. That's what's going to be inside of pre-cum. Okay? All right. So we already talked about all this. I forgot. It was on a different slide. So what's in semen? Nutrition for the sperm, things that help activate the sperm, and these prostaglandins, which get the female body ready for the sperm to go in. Those of you that had lab yesterday, who had lab yesterday? A couple of you did. Kaylin, Erica, a couple of them are here. The pregnant uterus we dissected yesterday had a really visible cervix. The one we did in lab Thursday, remember, he had all that other stuff because he pooped on us, right? Well, the one from yesterday, the cervix was perfectly visible, and I could show them the mucus plugs on the inside of the cervix. Okay, so in addition to helping make the woman's body go backwards to get the sperm in, those prostaglandins also get some of that mucus out of the way so they can actually get through the cervix. Because cervix is hard. It's pretty tough on the poor sperm. Okay? All right. Just a little number to throw out there at you. In 1 ml, so that's 1 cc in a syringe, in every 1 ml of semen, there's somewhere from 20 to 150 million sperm. Okay? Most men make at least 2, sometimes up to 5 mLs of semen in every ejaculation. Okay? So ladies, you should have some respect for what they are doing. That is a pretty big job for them to make all of that sperm. And what was the guy in lab joke yesterday and said they really hate that job, but it is a big job for them to have to do. That's a lot of work to make all that sperm. Okay? Women only make 1 egg a month. And we're just kind of snobby about it. We're like, well, we'll just make 1, and if you want to get us pregnant, you just have to make enough sperm, and it has to find its way to the egg. So think about it that way. The men are doing a lot of work. All right? So what causes an erection? Well, you already know the basics of it, right? What causes an erection? Stimulation. It can be a thought. It can be a touch, a smell, a sight. Any of those senses, some sort of stimulation causes your nervous system to release something, a neurotransmitter called nitric oxide. And it's just a different neurotransmitter, right? We've already talked about acetylcholine, glutamate, all these other ones. This is just a different neurotransmitter. That nitric oxide goes directly to the blood vessels in the penis and causes blood to leave the blood vessel and flood into the corpus cavernosum to make an erection occur. Okay? Now, just something a little funny, a little extra. Have you ever been given something really similar to nitric oxide called nitrous oxide before? No one's ever inhaled nitrous oxide? Where'd that happen at? At the dentist. You go to the dentist and you get laughing gas, that's nitrous oxide. Well, when a woman goes to the dentist and gets nitrous oxide, we just laugh. Everything the dentist says is really funny, okay? Well, whether you men realized it or not, when you go to the dentist and get nitrous oxide, it can trick the blood vessels around the penis and mimic the effects of nitric oxide. Many men get erections when they're getting the laughing gas at the dentist. The reason you've never noticed it is because you're kind of giggly and happy at that moment and you didn't notice it. So any of you that want to be dental hygienists, just be aware. It's nothing personal. They may just be reacting to the laughing gas. So, and I've actually had a man in my class before say, "Oh my God, I'm so glad to know there's a reason for that." So he had actually noticed when he would get laughing gas that would happen. All right. So ejaculation. Well, you got to have erection to get ejaculation. What causes an ejaculation? You have to have a whole bunch of muscles contracting at the same time. Okay? It has to be rhythmic. First, the epididymis contracts. Then peristalsis, different areas of the ductus deferens have to contract. And it all has to contract in the right rhythm to eject, is that the right word? To eject the semen from the body. At the same time, the sphincter muscles right underneath the bladder have to constrict. Otherwise, when all these other muscles were constricting, urine would come out too, and the urine would ruin the sperm. So that's a pretty important step in that the bladder sphincters have to constrict really, really tightly. Okay? Don't have to know a whole lot of detail. All right, last thing for today, I want to look a little bit more closely at the process of producing sperm, and that's just because I'm not sure you guys remember all of this from biology class. How many of you remember there's a difference between mitosis and meiosis? Remember there's a difference, right? Okay. Mitosis is what? One cell does what? Divides to make two cells that are identical to the mother cell, right? With meiosis, you have the first set of meiosis is just like mitosis. But then you do it again, right? And in the second phase, the cells don't look exactly like the mother cell. Okay, so a little terminology. The mother cell, the original cell, is diploid. It is 2N. It has two sets of chromosomes, right? Every cell in your body, unless it's mutated, has two pairs of 23 chromosomes. Okay? The gametes, the sperm and the egg, are haploid, 1N. They only have one pair of chromosomes, 23. Why? Because egg has 23, sperm has 23. When they come together to make the first stem cell of the baby, you want it to be diploid. You want it to have 46 chromosomes. Okay? So just to make sure you're keeping up with me. So over here, this is mitosis, right? First you replicate your chromosomes, make double chromosomes, split it. Both daughter cells are identical to mother cell. With meiosis, one cell becomes 4. Okay? With spermatogenesis, every one cell becomes 4 sperm that are actually able to mature to become sperm. Okay? Now that's just the generic picture you saw in biology class. What it actually looks like with spermatogenesis, you go from spermatogonia to spermatocytes. Spermatocytes become spermatids. Spermatids become sperm. Okay, great words, right? Much easier if I show you this way. Okay, inside of the testicle, men have tons of spermatogonia. Okay, men can make an infinite number of sperm because those spermatogonia are stem cells. They can divide pretty much for the entire life of the man. Okay, you're going to say that's very different for women. Women are born with the number of eggs they're going to be able to make. And then women go through menopause and they don't make any more. That menopause is when they don't have any more eggs. Okay? Men, that's why you can have an 80-year-old man get a woman pregnant, because they can keep making sperm. Okay? Those spermatogonia undergo mitosis to become spermatocytes. Then you have the next step, the second part of meiosis, which is where you make something that's haploid to make a spermatid. Where my cursor is sitting, do these look like sperm? No. That's what they look like all the way in the testicle, all the way out in the first parts of the epididymis. Okay? Once we really start getting to the epididymis, we make spermatozoa. Looks more like sperm, but they still can't swim. Once they get to the end of the epididymis tail, they finally become a spermatid. Then they can swim. Okay? Another picture that's going to be on your final is a picture of a sperm. Okay? And these are the parts of the sperm that you're going to have to know. Okay? So I'm going to flip back to the picture to point out all these parts. Okay? All right, just use this one. Okay? On the sperm, you have the head, the midpiece, and the tail. The head of the sperm is where all the parts of the cell, the nucleus and all that stuff is found inside of the head. Also on the head of the sperm is something called an acrosome. Okay? Because eventually the body hopes that sperm is going to come in contact with an egg. The egg is solid, right? Okay, it's not like you see on TV. The sperm doesn't have a little mouth and it doesn't like bite off parts of the egg until it can get in. The sperm has that acrosome, and the acrosome spits out little enzymes that dissolve the wall of the egg until it can get in. And once the sperm gets in, the acrosome sends out other signals and tells the other sperm to go away, that it has already penetrated the egg. Otherwise, we'd all have multiple births, because it's never just that one sperm makes it. A bunch of them get there. Okay? The midpiece is full of mitochondria. Why does it need so many mitochondria? Got to swim. Got to make all that energy. Okay? And then the tail is just for propulsion. It is just a flagella, like we see and like you think of. It just whips like a little tail. It's a eukaryotic flagella. Okay? All right. Now, the last few slides are strictly hormone-based. And like I said, we're not going to focus on that too much with men. Now, I want you to know there are special cells inside of the testicle called Sertoli cells. Their job is to produce the hormones. Okay? Well, hormones do, as we said, tons of things. The main thing we're worried about with the hormones is helping our sperm to mature. Now, this slide looks kind of bad, but it shouldn't, because all of these words should look really familiar to you. Okay? The hypothalamus releases gonadotropin-releasing hormone. Y'all remember this? Very first day of class, probably. Gonadotropin-releasing hormone goes and messes with the pituitary, tells the pituitary to secrete FSH and LH. What does FSH stand for? Follicle-stimulating hormone. It's going to go down and stimulate the male follicles, which are portions of the testicle to make the man produce the testosterone. Okay? The LH is luteinizing hormone. Luteinizing hormone goes down and tells the testicle, make sperm. And you're going to see females have these same hormones, and the follicle-stimulating hormone is going to make a woman produce estrogen. Luteinizing hormone is going to make the woman produce the egg. Okay? So as far as the man's concerned right now, GnRH triggers the release of FSH and LH. FSH makes him make testosterone. LH helps to make testosterone, but also this is your big trigger for spermatogenesis, producing the sperm. Okay? Testosterone, I know I said this at the beginning of class. Testosterone is the major hormone for men. Helps them make a sperm, helps them become a man, meaning gives them their secondary male sex characteristics, which I think are listed on the next slide. Yeah. It makes their metabolism slightly higher than women's. That's why it's easier for a man to be thinner than for a woman. Tons of different things, all related to the raising and lowering patterns of testosterone in men. And that is it for the male reproductive system. We'll pick back up with female